Hi everyone, today we are going to discuss about the inferior alveolar nerve block and the lingual nerve block. First, about the anatomy of the inferior alveolar nerve block and lingual nerve block. It's a branch of mandibular third molar, and this is a branch of trigeminal nerve. This mandibular nerve comes from the foramen ovale and enters inside the lingual side of the mandible, goes inside the canal, mandibular canal, and supplies all the teeth of one side and the buccal periodontium, as well as the lingual nerve supplies to the floor of mouth and the lingual mucosa. So, about the inferior alveolar nerve block and the lingual nerve block, we have to get some landmarks properly so that we can give a proper technique of it. So, the landmarks are the coronoid notch, pterygomandibular raphe, the occlusal plane of the mandible, and as well as the lingula. Fine. So, how to go about it? We'll show. We'll use the needle of around 25 to 27 gauge syringe, in which we'll follow all the landmarks. The positioning of the syringe is in such a way that the needle should get inserted in the pterygomandibular space approximately 6 to 8 mm above the occlusal surface. The syringe should go from the opposite arch at the premolar, intersecting between first and second premolar. So keep the thumb of your non-working hand in such a way that it should correspond to the pterygomandibular raphe and the coronoid notch, and the thumb will determine the height of the needle insertion. So once I enter from the opposite side of the premolar, at the height of the my thumb, which is approximately 6 to 8 mm, insert the needle. Approximately half of the length should be inside the mucosa. Once you insert it, stabilize the syringe, aspirate. On the negative aspiration, start injecting the solution. So approximately 1.5 to 1.8 ml of solution in the space of 30 to 60 seconds has to be given. Then to give lingual nerve block, change the direction of the needle in such a way that the syringe should now move from opposite side to the same side at the same height. Because the lingual nerve is on the medial and anterior to the inferior alveolar nerve, we have to do this maneuver, and then again aspirate it and provide almost 0.8 to 1 ml of solution. Now, after the injection is given, we have to wait for 3 to 5 minutes for the anesthesia effect to come. Right? So, the patient will tell about the numbness in the lip region, the buccal gingiva, and the tooth.